Gen Z and millennials, that is below 40 and below 30. Is there a huge number of patients with hip problem who come to you?
Post-COVID or the pandemic era, after that, I think we see a lot of patients having hip problems, especially what is called as avascular necrosis. That means the blood supply to the hip joint is lost. That we are seeing very frequently in younger patients, especially who are in 20s, 30s and 40s.
20s also?
Yes, we do see them even at 16, 17, 18 also.
Why so?
I think COVID is a hypercoagulable state, and that is causing blood clots, especially in the hip joint, and that is preventing blood supply to the hip joint, and that is when the bone dies, and that is what is called as avascular necrosis of the femoral head.
So doctor, do people get confused between hip problem with knee and back problem?
It mimics or it gives you a wrong idea that you are having a knee pain. That is because there's something called as a referred pain. That means you have a problem with the hip joint, but you assume or you feel a pain in the knee joint. So you feel that there's something wrong with your knee and you constantly think about it, but you do not come to a diagnosis because your knee is normal. The same way, a hip problem can present as back pain. And people do get confused and they go to the doctor much later to find out actually there is problem in the hip joint. That is how the hip problems get delayed in terms of diagnosis.
So how late is the identification of a hip problem? How do we know that?
I think most of them whom I see, I think because of the referred pain, or they think that the hip pain is just pain because I have sprained something or I have worked something, overworked, and I'm getting pain in the hip joint. That is what they assume because the pain comes and goes away.
Yeah.
That is how it comes. And by the time they reach to us, I think it has crossed a stage where we cannot preserve the hip and we need to do surgical interventions.
So that is hip replacement, is that right?
Yes, there are two types of surgeries. One is called as a hip replacement. The other one is called as hip preserving surgeries. There are two different, where you want to preserve the hip and maintain the natural hip. And the other one where it has damaged significantly, you cannot preserve the damaged hip in these cases, and then you do a hip replacement.
Which is the daily activity which usually damages the hip?
There's a change in our lifestyle. That is the main reason why we see a lot of hip problems in younger patients now. I think as a child, I would have sat down, I would have squatted, I would have sit cross-legged. But I think nowadays children do not sit that way. They sit in a high chair, and the habit of sitting down has drastically come down. By sitting down or squatting, your hip joint really develops very well. So that, and second thing, because nowadays people do not sit down, and children, most of the time, the games have changed over a period of time. Now people want to play something like football or basketball. All these games, you do not sit down.
Yeah.
And because your hips are not developing very well, you will develop hip problems because of these high impact games
so
at a much younger age.
Even simple games like goli or lagori or kho, all of these kind of gives more strength to the hip.
Yes, what you're saying is absolutely correct. As a child, I still remember me playing kho, where I had to squat and sit down. I don't think so now people are playing those games at all. So for hip to develop very well, I think the initial periods of your life, that is up to your teens, I think it's a good advice for you to sit down frequently and squat frequently.
So strengthening the...
Yes, your hip develops very well. You see, the hip is a ball and socket joint. So for it to develop very well as a socket in which the ball sits perfectly, I think you need to squat and sit cross-legged. That is what. Once you don't do that, your hip cup doesn't develop or deepen up, and then you develop problems, what is called as femoroacetabular impingement.
So, Dr. Ashok, let's say I never played these kind of games which I need squatting and I need to strengthen my hip. What would one advice that you would give?
I think a lot of people will do exercises, especially on the calf. They want to build up their knees. The knee problems are more than what you see on the hip problem. So I think they concentrate on the knee and calves. But I think very important for you is also to develop the muscles around the hip joint, because the hip joint is the one which takes the brunt of your weight and activities. So I think the hip joint exercises like the gluteal strengthening, that the ITP strengthening, the hamstring, which are also equally important for the hip joint. I think you should strengthen up your hip muscles also.
How about basic walking? Is it a must to build strength in the hip?
Yes, basic walking is very helpful for the hip joint, because when you walk, what happens is the synovial fluid, the fluid within the hip joint, will be circulating around the hip joint and will keep your hip very mobile. At the same time, if you strengthen up your muscles around the hip, they will take the impact of your load or your activity, and that also prevents your hip joint. So walking helps you to become mobile, and the muscle strengthening will help you to take the brunt or avoid injuries.
So you would say walking, swimming, cycling, all of these are very good for hip to build some strength.
Yeah. If you give me a choice between walking, swimming and cycling, I would rate swimming as the best exercise for hip, followed by cycling, and then walking or jogging.
Okay. So Dr. Ashok, what is the early sign to say this is the hip problem?
Yes, one of the earliest sign is having pain in the groin. So a lot of people will not understand why I should have a groin pain. They assume it is just because of some sprain. But in fact, the hip problems, the first thing you come to know about it is pain in the groin. The other things are called as referred pain, pain in the knee, pain in the back, or while you're sleeping, it becomes a little difficult for you to turn. Okay. That is one of the earliest indications that you have a hip problem.
Yeah, that's very interesting, no? Because many of us, we take it for granted.
Yes.
I think hip is the most reckless part of the body.
Yes. So what I realize is knee, even if you have a problem, you can get away with your daily activities with pain. But any problem in the hip, I think your daily activities are hampered very badly, and you kind of become a disabled man because of hip problems.
So when you say hip issues, is it more in women or is it more in men?
I think both the genders are equally affected in hip problems.